We start with defining diagnostics and assessment. A lot of terms are Harris. I'm an assistant professor here associate professor here at Howard University. And this morning I will talk about diagnostics and the diagnostic process. We start with defining diagnostics and assessment. A lot of terms are used to basically describe the same process. At the end of my slide, I've written assessment equals evaluation, diagnostics, troubleshooting. Speech-language pathologists naturally engage in diagnostic processes every time they meet with their clients. Particularly if you have a brand new student, a brand new client, before you ever meet them. When they're walking to meet you, you're assessing how they're walking. You're looking for neurological differences. You're looking at their face to look at symmetry. You're looking at how they greet you, whether they greet you at all. We are problem solvers. We are excellent problem solvers. We engage in diagnostics in an ongoing way, fashion, and when we first meet people. And as we all know, we engage in diagnostics through the use of tools. But diagnostics is a process of collecting valid, reliable information. And I'll talk a bit later about validity and reliability, which is information you're expected to know. So you collect valid, reliable information, you integrate that information, you interpret that information, and you make a clinical decision. Interpretation is the area I like to talk about a lot because that's the area in the diagnostic process that can be different among clinicians. I can look at data and look at a standard score or a different type of diagnostic score and look at student performance and decide a totally clinical different path for intervention than someone else. And that's based upon my beliefs about language intervention. So other aspects of the diagnostic process tend to be a little more standard or formal. But the process itself, no matter what method of assessing, involves similar steps or the same steps. So what does make a good assessment? What makes a good assessment? First and foremost, an assessment must have foundational integrity in order to be meaningful. There are 5 principles of a good assessment. An assessment has to be thorough. A good assessment uses a variety of assessment modalities. Notice I'm saying a good assessment. We are taught, or we teach here at the university, that if you are assessing for, let's say, large areas such as language, you don't use one assessment to determine language disorder. You use at least a couple. That is good practice. I emphasize the word good. You want to use an assessment tool that's valid, and I'll talk about validity in a second. And you want to make sure the assessment tool is reliable. Most of all, you want to make sure the assessment tool is tailored to the individual. It's very important. My area of expertise happens to be augmentative communication. And in augmentative, the whole assessment has to be tailored towards the individual because we're not talking about a disorder category. We're talking about ways of helping someone to communicate using tools for communication. So it has to be so specifically tailored. So those are principles to make good assessments. What do you think about when it comes to the assessment steps? I know in your heads you're already thinking, well, I know the steps of assessment. So if you go over them in your head right now, what do you do when you do an assessment? You do?
Okay. Talking to the teacher and the parent, get information from the parent and teacher about the student.
Okay, we all have good information about how to engage in this process or the steps. But what I want to show you is what is considered by Yasha the complete list of steps and during an assessment. ASHA says there are 7. They said there are 7. I know as I sat down and looked at this, I thought, now I know how to do an assessment, and I went over the steps in my head. Steps I came through was not 7. Okay. So I do it quicker. But constitute a good assessment. Okay. Step 1, you're absolutely right. You have to obtain historical information about the client's family, caregivers, and the nature of the disorder. Why? Because you're looking for etiological explanations. Are there social problems for this causing this disorder, or are there neurological problems? History gives you that information. A lot of us are very interested in birth history. We want to know from, day 1 of a child being born, whether that history was atypical in any way, shape, form, or fashion, to give us understanding of what's going on. Someone mentioned interview, and that's correct. We do interview significant caregivers. That can be classroom teachers, parents, grandparents. But we're trying here again to find out what are the significant situations we find our clients in where they are not communicating and where they need to communicate better. Okay? This is really important because at the heart of our jobs is really satisfying our clients and those around us. So including caregivers is very important in an interview process. Third step, we're coming into familiar territory, the oral facial exam. We're looking for syndromes, anatomical differences. The exam could be very lengthy, or what we typically do is what's called screenings around this area. But it can be very lengthy, several pages to complete, looking at all aspects of the oral facial mechanism and functions. Fourth step. Now we're coming into very familiar territory. This is what we're very comfortable doing. We're evaluating articulation, speech, language, fluency, voice, resonance. In the case of dysphagia, we're assessing chewing and swallowing. I remember being taught when I was in school back in long time ago, that you always do hearing screenings. You always look at sensory modalities. Sensory dysfunction is at the heart, we know, of a lot of communication disorders. Always look at hearing. Step 6, evaluate assessment information to determine impressions, diagnosis, conclusions, prognosis, and recommendations. So at the end of our evaluation reports, we should actually have all of this information. There usually, we teach our students to have a separate section at the end of the report for prognosis, recommendations, conclusions, summary, if you will, impressions. Impressions are very important, because that's the part of your assessment that you're going to take. And number 7, share. You can share your findings through interview or counseling conversations with your client or with the caregiver, with the teacher. You're going to share through written reports, with other professionals and significant people in the life of the child that you're working with. The steps in the assessment process, very familiar to you all. I just happen to be very conclusive in listing the 7 steps. But before we engage in diagnostics, we have to have an understanding of the methods that leads us to prognosis and conclusions and recommendations. We have to understand psychometrics, if you will. Okay. All right. Psychometric principles. As I mentioned, it's a very important part of the diagnostic process, or the definition in the diagnostic process, to use valid instruments or valid tools. That's the word validity is very important. Validity has to do with, as I was taught years ago, the fairness of the test. Is the test fair? A more mature way of saying that is the test accurate? Is the test accurate? Does it measure what it's supposed to measure? Does it measure what it's supposed to measure? We're looking at the accuracy of the measurement. So looking at accuracy, there are several concepts to understand. We're looking at accuracy. One is a type of validity called face validity. Face validity relates to whether or not the measurement is good for testing particular criteria. So, a good example, you actually can use a fluency measure to gain some information about language. True? As the person is talking, you're listening to their syntax, you're listening for dialectical differences, but would you say that a fluency test, an interview fluency test, is a valid measure of language? No, it's not. No, it's not. You definitely can gain some information, but it's not valid. Fluency tests, the Cooper interviews, scales are designed to measure fluency and not designed to measure language. So face validity is exactly what it says. You actually can look at the tool, look at what's presented and tell whether or not this tool is going to measure what it says it's supposed to measure. For people in school settings, I'll tell you a really great example that I've run across lots of different times. A wonderful, well-meaning language arts teacher who will come to me and say, oh, this person has a language problem. And I'll ask, well, what is your evidence? Look, he's not using punctuation and he's not using capitalization. To me, that's not a valid way of looking at validity. From face value, I can just look at the tool they use and go, and that's what face validity is. Actually, you can just look at the test and say, no, you didn't really measure what you think you're measuring. Okay. Our definition of language disorders is different than that person's definition also. Content validity, very related to face validity, very, very related. Content validity looks at all domains of a criteria. So for us to measure language development disorder, we're going to look at morphology. We're going to look at semantics. We're going to look at syntax. We're going to look at phonology. We're going to look at pragmatics. Content validity has to do with looking at all aspects of a particular criteria. Construct validity. Another concept looking at this notion of whether a test measures what it says it's going to measure. Content validity basically looks at whether the test measures what it says it's measuring, and to what extent it measures what it says it's measuring. And the best example to me, when you look at an extent of a test measuring what it's supposed to, is the p-body. When I read reports about a person who has vocabulary problems, and they note that the p-body is a generalized test of vocabulary, my problem is the fact that knowing the p-body is a test of one-word vocabulary. It's not a generalized vocabulary test. And what I mean by that is that you're looking at a word in isolation and not in context. I know children who won't know a particular word, but you throw that word in a sentence and I bet you they can figure it out. So the extent that the p-body measures generalized vocabulary, I think it measures one word vocabulary. And that's actually what the test construct specialist will say also. Yes,
it's
ma'am.
very cultural, because when you give that test, a lot of our kids in the city, a vase is a picture, and they say it's that's a jar part. They use jar,
Ah,
so.
or
Or they
glass?
don't know what a
Yeah.
chimney or a fireplace is, because
Right.
they've never lived or seen
Yeah.
one.
Exactly.
Yeah.
I'm from the South, and the item, which is supposed to be a pail, we would call a bucket. My niece in New York uses the term covers, and we would use the term quilt. Different ways of labeling things. Very true, very true. It is a test of one word vocabulary. Next is criterion validity. Criterion validity is a correlation between a test and a criterion variable. That means that the test actually tests performance. We'll actually look at performance. The best example is the fact that IQ tests are supposed to be good indicators of academic success. That relates to criterion validity. Does the test correlate well with performance? Types of criterion validity is concurrent validity and predictive validity. Predictive validity, saying a word too much, actually is exactly what it sounds like. You test a person to predict how well their performance will be at some future time. For instance, the Goldman-Fristow has a stimulability measurement. Stimulability basically is sort of a predictor for us, whether or not the child will acquire those sounds without our help or with our help. Okay? Predictive validity, just predicting future performance. Concurrent validity, when the measure is compared to another type of, another aspect of the test itself. For instance, the self will measure grammar in several ways. Or the TOLD, test of language development, will measure grammar in several ways. For instance, in the TOLD, the test of language development, there's the repeating sentences aspect, where the child has to repeat exactly what you say. What we're looking for is the exclusion or the changing of grammatical structures. So we're looking at grammar. There's also the closure task, where the child has to give you the correct word at the end of a sentence. Bill is a boy, John is a boy, Bill and John are two. The child has to give you the answer. You're also looking at grammar. So concurrent validity has to do with the correlation of two or more subtests, whether they actually do what they say they do. Okay? Validity, very important. So we're looking at the truthfulness of the test. Just as important, you're expected to know about reliability. Reliability basically looks at consistency of a test. Is the test consistent across different conditions? And there are different concepts and schools of thought related to reliability. First, test, retest reliability. Reliability is similar to validity. I think a lot of the titles are very transparent. Test, retest reliability definitely looks at the degree of consistency from one test administration to the next. Consistency from one test administration to the next. So given that the test and the conditions are similar. So if you test little Billy in 2nd grade and I test little Billy, then our results should be similar. A measure of consistency is reliability. Now, looking at reliability, it's really important to look at whether a test, or if you feel a test is not reliable, is not consistent. There are some ways to look at that. One way is through split half reliability. Split half reliability is actually a psychometric tool that's used in creating tests, but we can use it clinically also. And what basically you engage in that process is administering half of a test and comparing the child's performance on half of the test with their performance on the other half of the test. For instance, if you were to give the P-BITE, pitch vocabulary test, and let's say that your student used 40 words on the test, then you would take 20 other words and see how well he did, compared to 20 more words on the test to see how well he did. Split half reliability. You're looking for consistency in using the test, okay? Is that understood? Is that okay? All right. Have a question?
Give an example of that
Sure.
with a language test rather than vocabulary.
Okay. Basically, here again, the self. I'm thinking of a test with lots of subtests. And you literally will look at, I really don't remember exactly how many subtests the self has, but let's say they have, 12. Oh, okay. Well, 3 of the subtests, let's say 6. Let's make this easy now. Let's say 6 subtests. You would give 6 subtests. See how well they perform. Let's say that they're performing very well in those 6. Then you give the next 6 subtests. You actually give the test at one time. And you just look at performance on the first 3 versus the last 3. And you compare how well they did initially and how well they did towards the end of the test. In a language test, you're going to start with easy items to difficult levels throughout the 6th test. So what we should not see, really doing great first 3, really doing bad second 3. I can think of an exception to that. I may see something along those lines with the population I work with. Children who have cerebral palsy, fatigue may be an issue. But generally speaking, you're looking as a measure of reliability of the test. It's one way to see if the test is reliable, okay? You don't want huge gaps across the test itself. And split half is a way.
You have to give the test at one sitting.
At one sitting. But you look at the results compared to the first half or the second half of the test.
Of 2 different tests?
Same test.
Same test.
Same test. I'm sorry, same test. You want to look at the first half and the second half of the test. See how well the person did.
And it doesn't matter if perhaps the first half of the test is looking at receptive and the second half of the test is looking at expressive?
It would make a difference. You're looking at parameters that should be somewhat consistent. Right, right. That's why a lot of tests would actually mix having a receptive part, then an expressive part. And as you all well know, that's how most tests are constructed. Receptive, expressive, receptive, expressive. So at the end of administration, you have receptive and expressive fused within the test. And you can do split half reliability analysis to see how well your child did. Another reliability index with testing is the rate of reliability. The rate of reliability, the intra-rater reliability, would involve a single rater who uses the same testing method, same test across a candidate, having the same conditions to make sure the outcomes are the same. Inter-rater is where you ask your friend or your buddy, your colleague, to test the child for you. And we're looking at reliability. If we have a parent that's challenging your test results, you may want to think about engaging in inter-rater reliability exercises. Yes?
I know we're not supposed to ask questions, but what about the learning effect? When you test something, you're not giving them 6 months. I thought you weren't supposed to give the same test within the 6 months period.
You generally speaking do not. You generally speaking do not. That's very true. That's very true. The only reason I would give the same test, here again, if you're being challenged. But you're absolutely right. You're absolutely right. Learning curve. People will, I know kids that are very smart, and they will remember items from the test. They will go find the answers, and they come back and do much, much better. Yes.
I was just thinking of a case years ago, I was on the parents, didn't, my test results, the psychologist, just, it was Western Park School up in Georgetown, she just was adamant that these test scores, took your child to a private, exact same thing. I said, fine, you pay for it, exact same results, so.
When we sit at the table with parents and administrators, it's very good or a great idea to talk about engaging in reliability assessment measures and validity assessment measures. And throwing out such language will help them understand that what you did was accurate and true, okay, and consistent. Talk briefly about alternate form reliability. Alternate form reliability is basically reliability that occurs from atypical types of assessments, observational-based assessments, okay? And these type of assessments, you're comparing normative data to what you're observing in a child. And there are a lot of reasons to do observational-based assessments or alternate form reliability assessments. With 3-year-olds, we have developmental norms, but most standardized tests don't really capture 3-year-olds very well. But we do have norms, and we know what to expect from these children. And engaging in a observation and relaying what we know about normal development from what we're observing is a way of reliability, testing reliability, and looking at it in reference to a child's behavior. Okay. Psychometric attributes of testing, reliability and validity, are the most important thing to know, particularly when considering knowledge that's required for the Praxis. Another important area to know is methods, assessment methods. Norm reference assessment methods, criterion reference assessment methods, and authentic assessment approaches. You all have probably all engaged in delivering norm-based reference tests to children. Normative tests basically are just tests where performance of your child is compared to a predetermined population. Performance of the child is compared to a predetermined population. You're comparing the child you're testing against peers. You're looking at their performance as compared to peers. Thus, a group of people have already been tested. Their test scores tend to clump on a range of abilities called the normal curve, and your child is compared to others in reference to this normal curve, okay? Norm reference testing. Next is criterion reference testing. Criterion reference testing is the type of testing that you see basically, or is most popular in school systems, where there's usually a cutoff score where you've passed a test or you've failed a test. You are looking at a child's performance based on some very specific criteria. Did they really learn to identify the nouns? You give them a test where they have to identify nouns. They have to identify 25 nouns on this test. And if they don't identify 25, which is the cutoff, then you can say their performance was poor or it was good. Criterion is reference. The child is not being compared to anyone else but themselves. Criterion reference tests are used to make sure that a child learns particular information that's been taught. This is the testee's relationship to very specific content information and how well they master that information. Authentic assessment approaches are more open-ended type of assessment approaches. This is the type of assessment that combines intervention with diagnostics. It's the type of assessment that I engage in quite frequently or most, where I am looking at a child's ability to learn information quickly and apply it, particularly in a realistic situation. In reference to kids with augmented communication needs, we want to see quickly if they are able to touch a button or identify a picture. So we give them a real life situation and we see if they are able to meet that need or that requirement. We look to see if they identify pictures at all or if they identify photographs. Usually photographs of things that they know. Real life assessment for real situations. Okay. We reviewed the steps in diagnostics, what is needed for good diagnostics. We've looked at psychometrics, and very important also is a code of fairness in testing, particularly in educational practices. So kind of sums what I've been saying, that selecting an appropriate test is very important. There are age norms for standardized tests, and they should match your client's psychological or chronological age. Administering and scoring a test, generally speaking, should occur in a very precise way to encourage reliability. Very important to report, interpret test results, very important. And the other code of fairness is to definitely inform people of what you found, informing test takers and or important stakeholders. Informing people of your test results basically boils down to counseling. Counseling ways of communicating assessment and treatment plans, progress and results to clients, family, and professionals. Very important how you interpret information. ASHA says that this is an important aspect of the diagnostic process that you need to be aware of. I have a case scenario where Mr. Thompson was told by his wife to go see the speech pathologist. So the case starts with the gentleman sitting on his couch enjoying television, and his wife says it's time to go see the speech pathologist. The speech pathologist administers a Boston test of aphasia, and upon conclusion tells the client, okay, I'll see you in therapy on Tuesday. She administers the test and tells the client, see ya on Tuesday, you'll be in therapy. Counseling is important. I love that example because it shows the importance of counseling. What did this therapist do wrong?
She didn't go over the very important result.
Yeah, exactly. Oops.
She didn't follow the 7 steps.
She didn't follow the 7 steps.
That's right.
This case, there's a lack of preparation. When we test our students, we prepare them in some way, shape, form, or fashion. Let them know that, look, you have to pay attention. I'm going to find out information about how you use language. You give them some explanation, even very young children. you give them some explanation to prepare them for the testing situation. This person violated one of the major steps, as you mentioned. She didn't give interpretive information. What do the test results mean? What do they mean? Also, she didn't prepare the client for therapy. Understand what he needs help with. Also, she should have talked to wife or the caregivers. Okay. Another aspect, or one of the steps is very important in a diagnostic process is your documentation. This is what we at the university use to grade you, because we have something in print. Documentation. Collecting and using information from other agencies is very important in documentation. We have to have reports from otolaryngologists when we work with our voice patients. Reports from social workers actually can be very important to our students. Reports from medical doctors. Very important to collect information from other agencies when applicable. Communication from other professionals concerning the client's history. Documentation. Look at all these documents. To be totally honest, if you just sit there and think about all the paper you have to handle during a diagnostic process, it's quite a bit. Look at the paper you have to gain, the paper you have to gain from other professionals, but look at what you have to generate also. It actually can be quite thick. Can be quite thick. Data gathering and interpretation. Administer the test, gather the data, you have to interpret the data. You write a report. Determining terminal criteria based on prognosis, progress, motivation. And procedures for referral and follow-up. All should be part of your report. Part of the documentation that you have to handle in a diagnostic process. Knowing what documents, including the follow-up documents, is very important, and something that is going to be expected of you to know on the exam.
Say that again, knowing what?
Also writing professional reports, as I mentioned, very important. Poor Mr. Thomas again. Mr. Thomas was referred to the speech-language pathologist by his general practitioner for a voice eval. So it's already aphasic, now he has voice issues. What documents must the speech-language pathologist possess at the end of her evaluation? What documents at the end of her evaluation?
Something from the ENT.
And her own documents that she generates also, the documents that she generates, okay, which is going to include the prognosis, the recommendations, interpretations, and referral, if necessary. So all those documents I mentioned, very important to know about. Very important aspect of the diagnostic process, in addition to documentation, is understanding and use of instrumentation in the diagnostic process. This is near and dear to my heart because a lot of my diagnostics that I do with limited speaking augmented communicators involves the use of instrumentation. Instrumentation is used quite a bit in speech language analysis and assessment. The purpose of instrumentation, is to use an instrument to help you measure speech language disorders, help you assess and treat, actually. Right off the bat, there are instruments that you can think of that are used in speech-language pathology. You may not typically use some of these instruments, but some of them you actually typically use. For Mr. Thompson. was referred to the speech pathologist by the ENT for difficulty with reflux, aspiration. What instrument or assessment tool would the speech-language pathologist use in order to determine the source of the problem? And for those of you who are not working with children who have dysphagia needs, then what instrument would be helpful to record Mr. Thompson, his disfluency, or gather information about disfluency index? He has problems with disfluency also. Yes, ma'am.
A modified variance form?
Yes, for the first, very true, for the first. Secondly, Mr. Thomas is standing in front of you, and he has fluency difficulties, and you're looking at his secondary behaviors, but yet you also have to do a stutter word per minute count. What instrument do you typically use?
That's a sign.
Diagnostic.
Stuttering in the door.
You're giving me really great diagnostic tools, but metal or electronic instrumentation. Electronic instrumentation.
Oh, so tape recorder.
Yeah. Yeah. Tape recorder. Tape recorder.
But I have a question out here, I'm sorry. In schools, because sometimes we do get children who are referred because of swallowing, if we wanted to look at that, I mean, just kind of informally, because we don't have tools necessarily to formally assess that, would it be appropriate for us to, you know, obviously observe them maybe during lunch or whenever they're feeding, but also to maybe give them different textures of foods ourselves?
You can't go wrong. You're okay. You want to give them, you want to be very careful. And what you're doing by doing that is just providing information for the referral. So what you have to first and foremost do is refer. Some SOPs are not comfortable doing anything without referring first, because you do run the risk of aspiration. Even in giving children something like pudding, which you think would be smooth and easy, you are running a risk. But if you observe him eating pudding, you can write that down and feed that information during your referral. Yeah. And it's good to observe. I think observation is a great thing. I think you're running a risk when you start giving them things. But observation is a great thing. And as they normally would eat different textured foods, write down how well they're dealing with it. Part of the documentation in the process. So, speech language assessment, why do we do it, what's involved? We're establishing the client's past and present status, as I mentioned, through interview, through case history information, through reports from other professionals. We're formulating recommendations including impact on life conditions. Very important to know, for me, for instance, in argumentative, where's my child not communicative? They may be communicating at home, but maybe not in school, okay? You want to know types of treatment and service delivery models. That should be part of your suggestions at the end of your assessment. You want to identify individuals at risk as part of the assessment process, typically called screenings, or students who receive a full-blown assessment. Sometimes you may deem to be at risk. Thus, they may receive services because they're at risk, based on your school system. Some school systems won't allow for services for at-risk kids, some will. Those that tend not to is because caseloads are running high. I know a school system with that said. Your interviewing techniques and interpersonal skills, very important during the assessment process. What you want to do is gather information from your client. So having a knowledge base, which we provide here at Howard and throughout other universities, as is mandated by our accreditation agency, is to understand diverse cultures and diverse individuals. Because at the end of the day, what you want is information from these individuals. So establishing a good rapport is very, very important, okay? Procedures for screening clients, very important at all ages. Selection and administration of non-standard evaluation procedures, very important. Thank you. Selection and administration of non-standard procedures, such as language samples, observation. It's important to know about. In the category of assessments, then open-ended assessments would use language samples and observational data. And lastly, 12-year-old Andy is not achieving well in school and has been referred with the main complaint that he always asks to have assignments repeated in class. The teacher will give the assignment, Andy, she can count on to ask, what did you say? What was the assignment? Which areas of speech language assessment are used? What type of documents do you have to gather?
I would first go to the nurses here, ask parents, is everybody's here?
Very good, very good. Does Andy sound typical with some of your kids that you work with?
Yeah, a lot of work.
To really get the problem from just this little scenario, there are a lot of avenues. I like the fact you go to the quicker avenues, find out from other professionals that there's a hearing problem. Sometimes, as you know, we have to do in-depth testing. In-depth testing, someone may have hearing that's perfectly fine, but yet you know they're not processing auditorily. More testing is needed. In prescribing tests, your job is to make sure your tests are valid, reliable, and that all the documentation needed is generated, packaged, and then you must be able to interpret, counsel, make prognosis, and develop an intervention plan. Recommendations.
A question, well, a comment, really. I had a student is diagnosed ADHD, and usually those students, some of them, you know, they're not attending, so they miss a lot of information in the class. This is a little kindergarten. I observed him, he's all over the place. He's jumping and doing the circle jump. And the teacher said, Mrs. Proctor, watch this. He came back with everything. He didn't miss a beat. What is that? He absorbed everything. I'm like, he's an interesting little boy. Very bright, but you would never think he was he was listening. He's not listening. He's off, but he could give everything back. Like, okay, what is that?
I love your question. It brings a big smile to my face, in that you're describing, to some degree, my own sons. I do believe that culture plays a factor in that to some degree. My sons weren't diagnosed with ADHD, but one thing they've learned to do is to attend in a busy environment. My household is very busy. So my son actually could be playing a video game. I walk in the room and ask, where's his little brother? He's able to tell me exactly where his brother is and exactly what his brother's doing, because he's just environmentally aware. He's a very wide observer of everything around him. When he's walking down the street, wide observer of everything around him, and a really good problem solver. It's a person that thinks very broadly. And a person, when it comes to taking standardized tests, sees the gray because of his way of thinking, lifestyle, which has developed that way of thinking. Yeah.
Bright children.
Any questions?
I do have one.
Yes,
Could you just go over intra-rater?
Thank you. I wanted that intra.
Thank you.
Please.
Intra. Intra-rater reliability, there are two aspects. One aspect has to do with making sure that different portions of a test, if you give a test, the different portions of the test that you give, you yield the same results of different portions of a test, okay? And you're yielding different portions using the same tester, So I give a test, and I'm going to make sure, sometimes this happens with the child. This is a great example of a young man who's very busy. Sometimes I administer some items, the child is busy. I may move on to something where he has to focus on pictures, okay? Then I may move back to the item where he has to give me definitions, which is a little less structured. Intra-rater reliability, same tester, but I'm looking for consistency in his being able to give me a certain amount of responses, of his being able to attend and respond. That's a good example of intra-rater reliability. I can give you a textbook definition of what I wrote. Which I think I just outlined it. Inter-rater reliability, you actually can have someone else come in, but there has to be consistency across the task and the conditions. You don't want to go to the classroom when you had a one-on-one situation, if you're going to have someone else to do testing.
Excuse me, you said across, consistency across paths?
The conditions. Okay. So the conditions mean the environment. If you're going to have someone else test also. Okay. Intra-raters, a single rater, the tester, who uses the same methods and test and conditions. One person. Inter-rater, you actually can use a second person. Some people refer to inter-rater or defines it as slight deviations in the, or variations in the method and the instrument and different tester. Generally speaking, in our discipline, we talk about a different tester, the same instrument, same consistency across the environments.
And that would be inter.
Inter.
So the example that I wrote down was, you said, say for example, if you're being challenged, because I think you asked about if you had like a